Hello, and welcome to the Nursing Economics podcast series. This series provides extended content relating to articles published in the journal, such as interviews and roundtable discussions. Before we get started, we have a special offer for our listeners. You can save 50% off 1- and 2-year subscriptions to Nursing Economics. Simply visit nursingeconomics.net, click subscribe, and enter promo code NECSAVE50 to take advantage of this special discount. Overwhelmed by the people side of COVID-19 fallout? Worried about staff leaving and difficulty in recruiting candidates as the next nursing shortage looms? How can mission-critical outcomes be achieved with the ongoing stress related to COVID-19 as well as other crises on the horizon? This 2-part podcast series addresses the compelling and urgent need for organizations to develop healthy workplaces with emphasis on wellness among the workforce community. In Part 2 of this 2-part episode, Doctors Therese Fitzpatrick and Nancy Valentine discuss strategies for developing a wellness program for healthcare organizations. They address concerns shared by leaders in nursing, medicine, top administration, and board members, and present the multifaceted factors associated with the occupational hazards associated with being a healthcare employee, and suggesting an array of specific strategies for program development. This episode provides extended content from the Claiming the Corner Office series in the September-October issue of Nursing Economics. We are pleased to present Part 2 of this important discussion between Drs. Fitzpatrick and Valentine.
Hello, this is Therese Fitzpatrick, editorial board member for the Journal of Nursing Economics. This is the second in a 2-part series on the topic dealing with COVID-19 post-traumatic stress, strategies for preserving the nursing workforce and supporting all vital frontline personnel. We have with us today, for the second part of our recording, Dr. Nancy Valentine. During the first discussion, Nancy focused on elements to consider in framing the business case to educate healthcare leaders on the compelling evidence of the factors involved in transitioning to a healthy workplace. The second discussion is focused on strategies to consider in developing a program. Nancy, in our first podcast, we talked about the compelling reasons why we need to frame the business case for shifting our organization to health and wellness. If we are going to make the changes, which we must do, where should we start?
Very good. Well, thank you again, Therese, for teeing this up. And I think for our listeners, I'd like to just briefly recap some of those takeaways from our discussion on framing the business case. As I said at the end of that first discussion, we're not talking only about recruitment and retention of staff. We know the figures and the cost of recruiting and retaining people. What we're talking now is a more expanded view of the business case, one that ties mental health support for all of our staff, not just the nurses, but everyone, to really improved outcomes for patients and for the whole mission of the organization. So let's go over a couple of those key points that were presented. One is that much of the stress that nurses report is really related to how the work is organized. So those organizational factors really finally need to be addressed across the industry. These include adequate staffing, more inclusion of nurses in decision-making, less onerous, repetitive tasks such as multiple requirements for documentation, etc. I think we know what they are all too well, but really sort of buckling down and revamping those workflows and eliminating this redundancy has to be a high priority, and really understanding that these are part of the whole continuum of mental health support. Because when people are stressed out just trying to get their job done, obviously they're not feeling great about how their shift has gone. Building a healthy workplace is really also starting with needing to recalibrate our expectation of what constituents think of resilience. We must view mental health of staff on a continuum of impact for individuals that range from mild to severe and that none of these states should be singled out and compartmentalized, such as impairment, nurse impairment, physician impairment, etc., thus targeting the elimination of stigma as related to the need for intervention. The other is to recognize that we are dealing with an occupational hazard. This is a population health issue for the profession, not a collection of weak individuals. Given that nurses, both male and female, have incidence and prevalence rates of anxiety, depression, and suicide, as well as high levels of burnout in key areas such as the ICU, ERs, and other high-intensity settings, mental health intervention and the creation of a healthy work environment is really essential, as many are experiencing associated occupational hazards of working in healthcare. So everyone can benefit from this approach, and as I said, the organization overall will advance its mission. Also noted that healthcare professionals themselves are not an easy group to work with around these issues, often resistant to getting intervention, and therefore there is a strong need to include staff leaders in the creation of a healthy workforce approach. What we are now going to talk about is we have to be really open to some fundamental changes. And there are 3 or so key areas that we need to commit to in order to be being in the process of program development. And these are namely, number 1, we have to have a shift in overall mission. Education and the adoption of well-being as being an integral part of the organization's mission. Although there may be those who are skeptical of such a sweeping change, the discussions we have had regarding the data that underpins the business case for this is compelling, and hopefully people that are skeptical will take a look at this and rethink. We need to recruit, retain, improve safety, and build a workforce that has all the tools needed to deal with such major crises as we've been recovering from this one, and we anticipate that there will be others as well, already being predicted. So this attitude adjustment with the goal of eliminating stigma, again, is not going to be easy, but must be considered. Shifting the focus to building resilient organizations that in turn encourage and help to build resilience among employees. So this resilience of an organization is also helping to have resilience building among the employees that work there. Seeing this tied to improve patient outcomes is also essential. These are not all in little different boxes. It all blends together. And then a real commitment to investing in people. Authentic leadership buy-in and unwavering support for changing the workplace. Leaders must communicate the importance of wellness mission and building trust among employees. For enlightened leaders who see the wisdom of this trajectory, the road to change will be arduous, but attainable. Many have already done a lot of this work. There are exemplars out there. But we know that there are leaders who simply do not believe in the value of wellness. It's hard to imagine, but believe me, they are there. And have a difficult time letting go of their more authoritarian approach to leadership. So for this kind of leadership style, the pathway will no doubt be littered with weak intentions, and outcomes overall will reflect that orientation. I think that the place to start is that it is essential to have these crucial conversations with the senior leadership team. This is not something that can just be assigned to someone. It has to be something that's embraced by the whole team. So, as noted in the National Academies of Science, Engineering, and Medicine's recently published 2021 report entitled The Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity, Chapter 10 is devoted to supporting the health and professional well-being of nurses. The chapter and charge is clear. They call for policymakers, employers of nursing, nursing schools, nursing leaders, professional associations, and nurses themselves. They all have a role in ensuring the well-being of the nursing workforce. The chapter also is an extensive review of the contributing factors to lack of professional well-being and provide information on areas that need to be addressed. Some of these exemplar issues were discussed in our discussion with framing the business case, but now they have really expanded on this. So if some of the things that I did not actually get a chance to talk about are really in this chapter, so it's very, very important. So the challenge is to take this knowledge and the realities of the stress and also the work that we have done with combat veterans, apply this knowledge with laser-focused intervention. As I mentioned in our first podcast, we have populations of interest to consider, which is including one, our current workforce, and the other, those who are considering nursing as a career, as well as those currently engaged in the educational process. So there are a lot of people involved in this. So we're discussing, what can we do? Where do we start? How do we really get to those high levels of excellence? Let's start with opportunities for organizations to improve communication and other outreach efforts. It's within our reach. We simply have to have that will to step up to the challenge. But doing this is not simple. It takes planning, focus, and commitment. That political will is something that has to be, as I mentioned, part of those crucial conversations in order to make fundamental changes.
Thank you for those important insights. As we have discussed previously, stress and the need to build healthy work environments is something we've known for some time in the profession. But this focus on how to respond quickly and build capacity for a healthy workplace as a result of COVID-19 is a new phenomenon. And we're just beginning to collect the evidence around effective strategies to assist our colleagues in dealing with these stressors. This also includes our leader colleagues attempting to create organizational strategies to support their staff. Can you speak to the work that's currently underway? What are you seeing out there?
Well, yes, we are in an early creative phase of change, as everyone, of course, has had to step up to the best of their ability in a crisis. Many leaders actually did create an active environment and were very responsive and also were able to advance building trust during the pandemic. And their dedication came through loud and clear. As I've already mentioned, strong organizations did very well during this pandemic as best they could, whereas those that really had not made any real major advances, they had a lot more difficulty in doing that. During the pandemic, there were many just-in-time policies and tactics put in place to address the crisis. An example of an outstanding nurse leader who was able to do this is Mary Beth Kingston, former AONL president and current system CNO for Aurora Healthcare, who shared such immediate interventions where they pulled out all the stops. And let me just list out some of the things that they were able to do, and she was certainly a leader in this. First of all was focus on communication, staying in contact with employees on a regular basis, keeping people informed, especially given all the rapid policy changes, which were considerable. Many hundreds of policy changes were being made practically on a daily basis. So just keeping people up to speed was really a charge in itself and a significant challenge. But just providing direction is not enough. Telling people we're not going to do it like this today, we're now going to start and we're going to change and do it like that is one set of communication. The other type of communication, which is also critical, is communicating compassion. And thanking people is critical. As one in the trench leader had commented to me, say thank you until it hurts. Compassion, support, not just giving direction and orders, and then following up with actions is what the workforce will respond to. They have to know you care. Research findings have concluded the importance of management presence, and that can be in many forms. You can be in person. That was hard to do, of course, in the pandemic, depending on where people were. A lot of people were working remotely. Emails, telephonic updates. It is staying in touch with people you care about, your employees. Secondly, creating economic stability in a time of great uncertainty. Some of the things that Mary Beth was able to do was COVID pay, incentives for working on designated units, the buyback for vacation time, which could be an example of where people got paid, twice of what their vacation time was worth as a way of incentivizing them to buy back their vacation and keep working. Pay for staff time off for those who had to go into quarantine. Funds for family care, child and older adults, so nurses could leave home and come to work. Pay for hotels so staff did not have to return home. Supporting remote work whenever possible, although hybrid work options is, of course, really not an option for frontline workers. people were able to slice and dice and be able to find those categories of personnel that could work from home, and it was very supportive to give them that opportunity. Lending support to leaders via investing in training for staff to provide peer-to-peer support. This was very good because they gave some training to staff, and this helped to offload some of the crucial conversations from just unit managers to staff. So staff could talk to staff. They had some support and training on how to do that. So this outreach could then be identified by symbols on their badges. So for those nurses who did sign up for this training, they had a little symbol on their badge which let other people know that if they had a problem or there's something they wanted to talk to, they could, tap on the shoulder of that staff member. There, of course, were referrals to employee assistants and also fast-tracking appointments for counseling for clinical staff. So as people were referred, the counselors knew that if they were a clinical employee, they would get first dibs on an appointment. Then actively listening to their shared governance council members. Staff often had suggestions that were quite easy to implement, such as opening up the gift shop so people could grab snacks. They were supplying healthy snacks on the unit. They also got involved in distributing comfort kits to staff who were wearing PPE to lessen the discomfort associated with PPE. Obviously, they tried everything they could think of, and people, of course, responded very positively to that. And the lesson learned were that the accumulation of all these little things made a huge difference. Communication, listening, and then acting were key. And many of these interventions can be carried over to post-COVID management based on the successes in creating a feeling among staff that clear steps were being taken and the workplace was safe as possible. Evaluation. You mentioned, what works. Taking the opportunity to evaluate strategies is another area where organizations and professional associations can partner to explore how best to conduct research. There is little research in the whole scheme of things out there, and now that people are very focused on this, the drive for research is going to become greater. So there is a great deal of opportunity here. Currently, there are several initiatives that could be leveraged that have been launched by professional associations. So let me give you a few examples. ANA has established a Building Strength Through Resilience Committee, and through that launched a Healthy Nurse, Healthy Nation program. So that could be tapped. American Nurses Foundation established a well-being initiative. And then, of course, the National Academy of Medicine Action Collaborative on Clinician Well-being has a whole comprehensive set of resources for planning for organizational change. So that's a real go-to website. And just this week, a new report was released entitled The Impact of COVID-19 on the Nursing Profession in the U.S. 2020 Quantitative Survey Summary. This is an effort achieved through the collaboration between Johnson & Johnson, AONL, and ANA. This online survey was conducted early in the pandemic, August 7th to 30th last year, 2020, and included 4,000 individuals based in the United States. Among them were 1,000 nurses, which included 236 APRNs, 250 students, 500 physicians, 250 healthcare administrators, and 2,000 general population respondents. This is a very, very good study. Based on the data collected, there is a series of recommendations that mirror many other studies and conclude that nurses are, guess what, underutilized and undervalued. So recommended changes include tackling all the root causes of stress, such as staffing and heavy administrative burden, as well as involving nurses in the selection of technology, involving nurses in innovation, providing more opportunities for interdisciplinary collaboration, where nurses indeed have a lot to bring to those tables. The report advocates taking a fresh look at nursing education as well, so that graduates are better equipped to play a leadership role in settings, both inside and outside of institutions. I think that these are all landmark pieces of information that are out there that can be easily accessed, and they also can be used to educate others about what can be done. The report that I was just speaking about, the collaborative report between J&J, AONL, and ANA, has a lot of rich data as well about physicians' perception of nursing, the difference between male nurses and female nurses, the need for mental health support. Again, these are echoing what a lot of other people have either been saying, have published, are reading, are speaking about, whatever. It's always good to have that validation that what people believe you need to do can be then validated by such a report. It gives us the tools to really be able to move forward. So I guess the question we're saying is, what can we do to build on the work that has already been done in a crisis? I think that one way to really take a look at this is to begin to build a framework for intervention. So you really aren't just do something here, do something there. You really have an organized model that helps you to figure out how you're going to strategize to do this. This, of course, requires a multi-pronged approach and has to be, again, a community effort. I think one place to begin is to focus on the individual. Not everyone is the same. We have to begin by meeting people where they are. And as I said previously, staff are at all different levels of need at any given time. There are ways of screening. It can be done. It can be self-screening. There are apps that assess mental health and provide feedback to the individual. But getting an idea and involving staff, like a self-assessment, where do you think you are? There are some, again, exemplars on how people have done this. Using a public health approach, then people can be categorized in three general groups with differing levels and different support interventions. So, for instance, when the pandemic was first happening, when I would talk to different CNOs, they would say, well, we're putting out online resilience training. People had to start wherever they were, and they had some package programs, and they were putting that out for everyone. But resilience training, which is also a good place to start, is really a primary level. It's focused on self-awareness, coping, and communication skills. But as we've already discussed, especially with some of the data on incidence and prevalence of anxiety, depression, some people are beyond just getting a resilience training, CEU. They really have to be screened for burnout and providing resources and support for nurses who are at that secondary level. And then, as we've already discussed, people that are really at the tertiary level are those that have really gotten to the point where their functioning has really been interfered with by all these stressors. And we know from the work, the PTSD work in particular in the VA, is that intervention is critical. So those who have gone through a traumatic event often experience insomnia, low self-esteem, a host of unpleasant thoughts that often lead to increased anxiety and depression and feeling numb to emotion. So getting help as soon as possible is critical. So I think that, again, just thinking about our staff and thinking about how we could really try to peel back where people are at and meet them at that point would be a very good place to start. But that's part of what managers and organizations can take a look at with their employees helping to figure out where they're at, primary, secondary, or tertiary. But then, again, in terms of getting people involved, every individual does need a self-care routine. And it's something that I don't think any of us are really great at. Some people are better at this than others. Such an expectation, though, can be reinforced by all organizations. Talking about it, getting people to really speak about their self-care routine, I think is a healthy place. In a first-person account written by Dr. Amita Avandahani, Associate Professor at Rutgers University School of Nursing and DMP at St. Peter's University Hospital in New Jersey, wrote an article entitled "Treating COVID-19 Patients in an ICU Nearly Broke Me, but Now I Am Stronger for It." It's an interesting review of her experience. She mentions in this article that she had already an established self-care routine of daily treadmilling and meditation. And she said that saved her early on, so she had the strength to carry on. Eventually, as she worked through the many lonely months, the stroke of insight she finally gained was recognition that no matter how much she suffered, the spouses and families were hurting worse, and that it was really her role to help them as much as possible. And through that whole reorganizing her thinking about what she was experiencing, she resolved to stay the course. But she said that also having the self-care routine was also very helpful, Because in a self-care routine, you have the opportunity for daily regrouping, processing events, and reflecting on life and personal health. You could even have that as part of a staff meeting. So people could share tips of how each person is developing their self-care routine and how to, share that with others. So for managers and leaders, it is important to acknowledge that stress is often not visible, but is manifested in various behaviors, often unknown. Therefore, people need understanding, not judgment. And this varies by person. It's not a prescription. Generally, to be more attentive to what is going on in people's personal lives, realizing everyone has a backstory of what they are concerned about. Perhaps we could benefit from the lessons learned in education and adopt a trauma-informed leadership style, which works on getting to the root cause of why, for instance, students are failing. This was something that really got started in education. It was very interesting when I was looking into this because they were finding in many schools that students were just not responding to the typical interventions to really help them improve in their work. And by taking this informed leadership style approach, like psychologists working with teachers, etc., they found that so many of these students had mental health problems that unless they started to deal with those, it was hopeless that they were going to improve in their studies. Because once they got to the root cause and they were able to, have these students see people or work with them in groups, things started to improve. So what does it mean to be a trauma-informed organization? It's really, again, an organizational structure and treatment framework that involves understanding, recognizing, and responding to the effects of all types of trauma. So becoming trauma-informed, recognizing that people really have different traumas in their lives. And we talked about that previously. People have a lot of things going on in their lives at home that then get brought in. To work, it's a blended kind of experience. Let's think about how we could even use that as a framework for dealing with our leadership at the frontline level. Because I think if we were able to have some of those crucial conversations with staff, I'm not suggesting that the nurse manager turn into a therapist. It's more that you really are able to help people identify for themselves what they need next. And that can be very freeing. And then the next point is to really steer them in the right direction to get whatever support they may need. But what you are doing through such conversations is that you are emphasizing personal resilience, and you're strengthening that by helping people to have realistic optimism. Optimism is, they say that it's 25% is inherited and that so many other factors really are influencing a person's positivity, such as the work environment. So the more positive, the more upbeat, the less stigma, the more you want to help people get on track, the more people will be realistically optimistic. Helping them to have emotional awareness and control over emotion is a part of this as well. And self-efficacy, helping people to set goals and moving forward to meet these goals. I just wrote a reference that earlier this week I was listening to a Sigma Theta Tau International presentation by young investigators, nurses from around the world who had gotten small grants from Sigma Theta Tau International to conduct their early research efforts. It was all over the map in terms of the topics of what these young people were doing. But what really struck me was the extraordinary excitement and enthusiasm that people had because they had a goal. They were so happy to get some support, have a place where people would listen to them, to be encouraged, to have that kind of happiness. People talked about their joy of being a nurse. We need more of this. When was the last time you really had a conversation with a staff member where they were talking about how joyful they are, especially in the pandemic? But believe me, with this kind of intervention, you can get to those things. People want to feel happy. They want to be joyful. But it's very hard to do it alone, especially in an environment that is not fostering those things. And connection with others is vital. So, we've learned a lot about connecting through the pandemic because we had to find all these new ways, Zoom calls, etc. Think of some of that and how it could be fostered within your organization. Not everybody has to get together face-to-face for a staff meeting. Maybe the people are working on a project, and maybe you as a nurse manager or a nurse leader want to encourage them, and you set up a Zoom call to have that consultation, that discussion, encourage them to move forward, get them connected to one another, help them connect the dots. That's very helpful. Then again, helping people to take care of their personal well-being. There are opportunities for people to do this at every level. The other is don't underestimate the power of your own staff, and you can focus on and leverage team efforts for generating creative ideas and enthusiasm. And this is across the board. This is nurses and others. Here are a few really, I think, outstanding examples. I don't know if you had the opportunity. This is something you can go on, YouTube perhaps. I forget exactly where it was, but the Norwell Health Systems Nurses Choir. Norwell in New York is a very large health system. And this group of nurses were featured on the audition for America's Got Talent 2021. So it's very recent. Their rendition of the song Stand By Me is truly unforgettable. They just blew away the judges. They received Howie's Golden Buzzer Award. They were extremely inspiring. The way they introduced themselves is that they were 18 out of 18,000 nurses in the system. But through this song and dance routine, they portrayed their energy, message, and desire to reach others and share their message of hope and resilience with the world. This performance, no doubt, had a ripple effect throughout the entire health system. And to anyone watching it, I think I've watched this song at least a half a dozen times. It's just so beautiful. So supporting such grassroots efforts to use talents to deal with adversity. I know that from just perusing the web over the course of the pandemic, there are other nurse choirs out there, other people doing things that are very creative and showcasing that. Not everyone's going to get on America's Got Talent, but there are other things that are equally as important to really use those as platforms to showcasing. The Massachusetts General Hospital has developed a buddy system, and it was patterned after the military, where staff were paired so there was someone to check in with every day, which again helped to reduce this impact of isolation. So when you were finished your shift, you could check in with your buddy rather than just limp on home feeling depressed. That helped to give people a sense of camaraderie. Then there was this lovely wellness response team at Rush University Medical Center, where their chaplain, Mark Schimmelfennig, I hope I pronounced his name correctly. This team rounded regularly on units to check in with staff on the front lines and offer support. This approach was given a feature article in the Chicago Herald Tribune. Again, people came up with ideas on how to intervene. And a wellness response team could really be making rounds on a regular basis. It doesn't require a pandemic. Aurora Health has instituted a chief spiritual officer. Again, this is their Reverend Kathy Bender-Switch. Her job scope includes well-being and the sustainability of the workforce, as well as work in the community and oversight of the ethics function. She was on a podcast, lovely woman, so dedicated to what she is doing. But again, I just want to point out, this shows that Aurora Health, as a system, is very, very dedicated to developing the sustainability of their workforce, and that she is working with all the other senior leaders. She was just not given the job of developing all this work and doing it by herself. It takes, as I said, a team. The next is focus on the organization, both acute care and all care environments where nurses work. And that's the whole part of building a resilient organization. Where do you start in building a resilient organization? I think that it's that real authentic leadership assessment. There is no substitute for strong, capable, and trusted leadership. Work with senior leadership teams may be needed to develop these skills and their resilience as well. Crisis has a way of bringing out the best and capable leaders, and it is also a litmus test for those who are basically really not up to the challenge. If you really are looking at some of the literature, there have been many CEOs leaving their jobs for all kinds of reasons. But I think that it does really require people to want to do this, and not everybody is up for it, as I mentioned. So organizations, mature and wise leaders, no doubt, as we know, fared a lot better than those where fragmentation and lack of genuine respect for the workforce was evident to the rank and file. So you have to look at your staff and respect them. and it will be returned if you live by the golden rule. It sounds so simple, but again, it really depends on the people to make that happen. So being authentic is also being transparent and letting your staff know that you as a top leadership team or as an individual leader, you understand what they're experiencing. Your family is seeking some of the same supports that you are recommending to others. People, for instance, know that you want them to get vaccinated because you want them and their families to be safe. That's a little bit of a different message than we want you to get vaccinated just for our patients, and if you don't, you can't continue to work in the organization. I'm not being critical of those organizations that did go forward. I give them my highest regard. But how you communicate that and letting people know that you really want them to be safe, I think is a very positive message. Being authentic, disclosing your own vulnerabilities really is something that I think is really important to do. And again, not every leader, whether they're nurses, physicians, or, the CEO and company, not everybody feels easily swayed to do that. Because what you're really trying to do is communicate that, we as leaders are stronger and therefore we do not need such help. That is not what you want to communicate. That, you don't want to be recommending to others what you can't say you're doing for yourself. So if you can be authentic, share what makes sense for you, what makes sense for your group, what is true, what are you doing, I think that's a sign of strength, not weakness, which is exactly what is involved in getting to the heart of the stigma that we need to be erased. The more you can talk about vulnerabilities and how you are dealing with it and how you are getting stronger through it, helps other people to say, well, gosh, if that person can do it, I guess I could too. Look at Prince Harry. He's really opening up Pandora's box, however you may judge that. But what's good is that he's talking about his own mental health issues. I have to give him a lot of high marks for doing that because it's not something that is easily done, especially if you're a member of the royal family. So if a member of the royal family can do it, why can't we? Now, if you do that, all that will start to trickle down. It will really be able to be added to the orientation of new employees. And believe me, the workforce will be better overall. The next is, after you really do that leadership assessment, people need education. Not everybody knows what we're talking about today. I have to say that when I was preparing for this, the more I read, the more I wanted to read. I learned a great deal from what is out there. And I think that senior executive team members, board members, people that are not necessarily right in the middle of the trench, they need to really learn about this. And that chapter 10 of the report that I mentioned, which is chapter 10, Supporting the Health and Professional Well-Being of Nurses, is a great chapter for people to read. It's intense, it's longer than a lot of little executive summaries, but it's worth it. It's very interesting. I think that senior executive team members and board members would find this of great interest. Those who, for instance, though, are tasked within a system or an organization to actually build a program, I think the nuts and bolts is really a good place to start. Taking the National Academy's press publication entitled Taking Action Against Clinician Burnout, A Systems Approach to Professional Well-Being, is also a very good document. That's a lot of things that we're talking about in this discussion, how you approach it, what you can actually do. I think the next step in the organization's retooling is to look at your mission statement and your strategic plan. Is any of this even in there? Is it a top strategic initiative? If not, you have to think about going back and taking a look at that. If the mission and plan is still there, you have a strategic statement around well-being, look at your mission, if it reflects it as well, then it's time to buff it up. Go back and see if it's as strong as you would like to have it. You have so many ways of really getting information from your own staff. You can talk to people. You can have focus groups. You can do all kinds of culture of safety surveys. They can add questions to those culture of safety surveys so that people are not over-surveyed with separate surveys on well-being. If you can measure burnout, if you can look for other sources of feedback, then you are on the road to really measuring the impact. Then we've talked about educating managers, knowing how they can develop their coaching skills. That's also another thing that was in the purview of the organization. I think then you can scan the environment for strategies and tactics that can be adopted. You don't have to sit down with a blank piece of paper. There are so many things out there that you could take a look at that are easily adopted and they're very low cost. Let me give you a couple examples. The Institute of Healthcare Improvement 2020 developed a psychological PPE, personal protective equipment. It's a simple checklist tool for promoting mental health and well-being that can be owned by individuals and unit managers. This is basically a poster that is posted on units. It's just a visual cue of what you can do to make sure that you are protected. Then the Mental Health First Aid at Work program that is offered by the National Council for Mental Well-Being, I think is really a very, very good program. It is peer-to-peer training, and this approach is something that they have used in 25 countries, and 2.5 million people have been trained. So the power of peer outreach can be tapped with such a program. Similar to what was done, Mary Beth Kingston, this is a very well-designed program that you can easily get information on their website and think about adopting this. I think that it's not a substitute for all the other things that we've talked about, leadership, using support services that are already designed in the organization, but it's something that could also add to those things. And I think that part of this communication is once you've got authentic leadership under your belt, you've got a good mission and strong strategic plan, part of that is communication, ongoing communication. CEOs have to broadcast and emphasize well-being, the dignity of the work, and highlight everyday heroes. This is a way of reinforcing appreciation and gratitude. Now, let me give you an example of someone that I truly admire and think has done an excellent job at this. I had the pleasure of meeting J&J's CEO, Alex Gorski, and he is frequently doing broadcasts to his employees that feature good work, and he personally thanks people as well as emphasizes needing to take care of self. He talks about, you need to take time off. Now, that's not easy because people that work for J&J, I know, work extremely hard and extremely long hours. But the fact that he is emphasizing take care of yourself is a great message. And here's where the J&J credo fits in. It's something for you to think about in your mission statement because their first sentence is legendary. It's, quote, "We believe our first responsibility is to the patients, doctors, and nurses, to mothers and fathers, and all others who use our products and services," end of quote. It goes on beyond that, but the first sentence is very powerful. So he reinforces that message in every broadcast to a worldwide employee audience. So he is indeed a leader to be admired for his passion, for being compassionate with employees. When you think of all the other things that J&J has been struggling with at this time, all the things that they've had to deal with their vaccine, etc. He hasn't succumbed to that. I'm sure he has a lot of challenges in any given day, but he doesn't lose his message. He keeps it upbeat for his employees. So we could take a lesson out of his book. The other is organizing this framework, as I mentioned. There are some services out there that you might want to take a look at. Gallup offers a well-being at work structure and training. This lays out 5 areas of well-being that can guide organizations in how to achieve that whole person balance between career, social, financial, physical, and community. Rather than just hoping that, we rely on policies and perks, this gets deeper into what has to be done to build these programs. And it also emphasizes the role of leaders to communicate the importance of the mission. Gallup also publishes, and again, this is so easy to access on their website, 10 well-being practices to guide leaders. It's worth your review, and it's a benchmark for assessing the current state of an organization, and it serves as a guide for instituting new practices, none of which are really all that difficult to do. In addition, we have already existing structures and processes that have evidence based for some time in yielding positive work climate. To give you a couple examples, the ANCC, American Nursing Credentialing Center's Magnet program, a journey is one that addresses being a strong and capable organization for nurses and all members of the organization's community. As of 2021, there are currently 561, only 8.9% of hospitals that have achieved magnet designation. So there is room to grow. Many of you listening, I'm sure, are on the magnet journey, and I applaud you for doing that, because part of this will help to embed what we're talking about in that journey. I think that there's also Schwartz rounds, as this allows for discussion of complex clinical situations, using a facilitator to foster participation and understanding of the psychological aspects of the work. At Mainline Health, where I worked previously, Schwartz rounds was something that we had invested in. It's so worth it, because for those of you who may not be familiar with this approach, it is a grand round style event that focuses on a case or a theme related to the emotional impact of patient care that care team members experience. A multidisciplinary panel of key staff members then facilitates sharing this experience, and then there is a discussion with an open forum of the audience participants. It is a valuable way to reflect on subjects that may not be typically discussed in a group forum. Having sat in on some of these, it is definitely powerful. People really come forward, they talk very openly because, again, it's a supportive environment. In terms of investment, it's, again, an organizational priority because it doesn't take that much to organize these things, but you can see just by the temperature of the room what the payoff is. And also, there are other standards that we can take a look at. The American Association of Critical Care Nurses for some time published a Healthy Work Environment Standards Manual. So this, again, is not new. It's just a question of picking these up and putting them in motion. It talks about skilled communication, true collaboration, effective decision-making, appropriate staffing, meaningful recognition, etc. There's also the DAISY Award. That is another one that is for extraordinary nursing care. The Sigma Theta Tau International Healthy Workplace Awards helps to really call out people that have done a great job. Then we can learn from others. Let me give you an idea on that one. You know, we've heard a lot about police and police issues, but many police departments have a requirement that routine discussions and rounds have to be made when there is an event. So if there's an untoward event, these folks have to go and talk to someone. I asked a nurse if she would go for a discussion with a counselor after COVID just as a check-in, just to see how things were going for her, and she said absolutely not. I asked if it was mandated like they are in these police departments, would you go? Her answer was yes. I would, as I know everyone else would have to go. So this is an example how staff do not, want to be called out individually. Another opportunity is look at what technologies are out there. Even Health is an innovative IT platform for building emotional strength. This is an app that people can go to and anonymously join into discussion groups. There's also educational information on stress and wellness, but this idea that you can anonymously go on and become part of a discussion group is quite intriguing. And I think that is, again, something to take a look at. The other is one that I think I was very impressed with, and that is how to implement best practices. In New Jersey, these folks get a gold star. They have put together a whole regional approach to implementing nurse workplace environment and staffing councils. They started with a test case of a few hospitals over the past couple of years. Now they have got the whole entire state involved, so they can emulate this toolkit and use it across all organizations. This was done with collaboration on the Organization of Nurse Leaders of New Jersey. Again, those are in print, those articles, something to take a look at. And then I think, lastly, always be on the hunt for novel solutions. I came across one just this week. I have graduated from the Harvard School of Public Health, so I'm a big fan of the Harvard School of Public Health, and I was on a webcast where I learned that they now have a Lee Kum Kee Center for Health and Happiness, which I thought was really outstanding to have that at the Harvard Chan School of Public Health in Boston. There's a whole website on resilience resources. So I think for health and happiness, that's a place to start. There are many, many things out there. I've only given you a bird's eye view and few examples.
Thank you. You've called out a number of really quite effective and pretty phenomenal strategies. Dr. Valentine, you are a member of a team interested in employee well-being on behalf of the American Academy of Nursing, related both to the study of the impact on nurses specifically, as well as our profession. Can you speak to the Academy's important role in this effort?
Yes, I would be delighted. The American Academy of Nursing, Therese, has great interest in clinician well-being. The Academy's expert panel on building healthcare system excellence has formed a subgroup entitled Well-Being Work Group. I'm a member of this work group, and the charge is to address this issue through the policy dialogue and a consensus paper. The policy dialogue will focus on ways to improve healthcare work environments, and it will cover issues that arose during the COVID-19 pandemic and how these issues impacted the practice of nursing, etc. The consensus paper, which is being considered by the board at an upcoming meeting, will cover policy implications and recommendations, and both aim to advance the AAN's priority of reducing patient, provider, and system burden, and will focus on the current evidence and initiatives, such as the National Academy of Medicine's recommendation and Future of Nursing report. And I'm happy to say that very recently, the Academy and over 50 other healthcare professional organizations, including many that we would be familiar with, just called out in their statement that all people in healthcare should have a vaccine. So they believe it should be mandated. This joint statement was published in the Washington Post, New York Times picked it up, and I'm hoping that this will help stimulate the other 50% of our nation to get vaccinated. But starting with healthcare employees is a very logical place to start.
Well, thank you. And really, we extend our thanks to the Academy for this important work as well. And clearly, with your expertise, they will certainly benefit this committee from all of the work that you have done around this. In conclusion, Nancy, again, I cannot thank you enough, both on behalf of the Journal, Nursing Economics, and all of our participants in this two-part podcast series. So I wonder if you wouldn't mind leaving us with some thoughts as we conclude the session today.
I would be very happy to do that, Therese, because, as I said early on, it's just a very passionate topic for me, and you'll have to always look at what's the silver lining. And COVID did bring us to this tipping point. Whether we liked it or not, we now have to stand up and look reality in the face and really take on some of these topics that we really hammered away here in this presentation, because so much of this we've known, and now we have to take up the cause and really solve these problems. I also think my colleague Bernadette Melnick, who is the Ohio State University Dean of Nursing, is another notable nurse leader who has really been calling for a paradigm shift in nursing, away from crisis management to mental health promotion and wellness. We've been in crisis management mode. I mean, we talked about that. And nurses have been on the forefront for so many years, and leaders and must now continue to join with others to make this happen. Now, I personally believe that nurses are phenomenal leaders. They can light the path forward. But I also am very aware that nurses being champions of this cannot be successful unless the CEO and key board members signal their unwavering support for this kind of change. So let's get started with those ideas in mind, everything that we've talked about, because it really is the right thing to do. It is a lot of work, but I really want to leave everyone with some little optimism based on history. Stress of a crisis does create breakthrough opportunities, and I recently heard about Sir Isaac Newton. This was long before he became a Sir, because when he was quarantining in 1666, at the young age of 23, during the plague, he really came up with a breakthrough discovery on how to more easily calculate pi, P-I, like in mathematics, which had been perplexing mathematicians around the world for centuries. He discovered advanced mathematics worldwide. His discovery, advanced mathematics from where it had been previously for hundreds of years. Who knows if he would have did this if he didn't have all that time? Would this have occurred? He had time to focus. to change his perception of the visual array of numbers and come to see that there was, guess what, a repeating pattern. He then found an approach to quantify this pattern so it could be calculated with a formula, whereas other mathematicians in the world were actually spending their entire lives drawing out countless arrangements of numbers and then arriving then at a mathematical conclusion. Isaac changed the approach and calculation with the creation of this new, undisputed formula. Voila, a revolutionary change and innovation in the field. Now, I'm not suggesting that we've all been sitting around quarantining. Everybody's been busier than they've ever been. But what this did was, what other choice do we have? And as I said earlier, I am more than happy to speak with anyone who would like more information or just to talk about your ideas on this topic. And in finishing, I'd just again like to thank you, Therese. You've been a great partner in this discussion, and the nursing economics team have been phenomenal for having me work with you on this important communication. It has been a pleasure to be with all of you, our listeners, and I wish everyone, our leaders, our staff, I wish everyone the best because I am very confident you can do this. Thank you.
Thank you, Dr. Valentine, and we appreciate your leadership in this really important work.
The Nursing Economics podcast series is owned and produced by Genetti Publications, Incorporated. All rights reserved. No portion of this podcast may be used without written permission. Dr. Therese Fitzpatrick is a Senior Vice President at Kaufman Hall and a member of the Performance Improvement Practice specializing in workforce strategy. She is also an assistant professor in the School of Public Health at the University of Illinois, Chicago. Dr. Nancy Valentine is President, Valentine Group Health, LLC, which focuses on building quality systems and grooming results-oriented leaders using evidence to improve healthcare in practice and educational settings. For questions relating to this discussion, you may contact Dr. Valentine directly via email at valentinegrouphealth@comcast.net. For archived episodes of this podcast and to learn more about nursing economics, visit the journal's website at nursingeconomics.net. You can also subscribe to the Nursing Economics podcast on Apple Podcasts, Google Podcasts, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and everywhere podcasts are found. And remember, as a listener, you can save 50% off 1- and 2-year subscriptions to Nursing Economics. Simply visit nursingeconomics.net, click subscribe, and enter promo code NECSAVE50 to take advantage of this special discount.